Hello, Marie Filion here again. Today I'm talking about the 6 different type of addicts. Now, even if you're not struggling with addiction or you don't know anybody that is struggling with addiction, one of the reasons why this is such an important talk is that there is a link with different ADHD types and the 6 different types of addicts. So the 6 different types of addicts, according to the neurobiology of the brain, is the first type is the compulsive addict. The next type is the impulsive addict. Number 3 is the compulsive impulsive addict. Number 4 is the emotional addict. Number 5 is the anxious addict. And number 6 is the temporal lobe addict. So I'm going to go through and describe these a lot more comprehensively. I'm going to give you some things that you can do for each of those in order to heal the different parts of the brain that these are associated with. But the 6 different types of addicts is a course that I give, and so this particular video is a lot shorter than the particular course that I do. So this is a really interesting table, and it shows you the interrelationship between ADHD and the different types of addicts. So here's the ADHD type. So you have the hyperactive and the inattentive. And then you have the combined type, which is what happens in what we call the DSM. That would be a DSM diagnosis. Now, there are actually 7 different types of ADHD according to, again, the neurobiology of the brain, which is another YouTube video that I do. So that might be of interest to you. So if you have the limbic ADHD or ADD, then you are more apt to have the SAD. You see how these two are linked together. And then the combined type, more apt to have the impulsive compulsive. Compulsive is just compulsive. And then the hyperactive and attentive goes with the impulsive here. Anxious with the anxious, temporal lobe with the temporal lobe. And then I will talk specifically about the ring of fire. So with ADHD, if you have a diagnosis of ring of fire, that's totally different. You can also see here, and this is again another or a couple more of YouTube videos I do. There are 6 different types of anxiety according to the neurobiology of the brain and 6 different types of depression according to the neurobiology of the brain. But you see how these are interrelated. So if you have the unfocused anxiety, you're more apt for the impulsive addiction, impulsive obesity, and the impulsive aggression. So I have YouTube videos in each one of those, but today I just wanted to show you the link with each one of these and talk briefly on the 6 different types of addicts. So here are the 7 different types of ADD, ADHD. I just wanted to write them out here for you so that you can see them. So the number 1, according to the DSM, which is the Diagnostic Statistical Manual, which is what psychologists and counselors use, is hyperactive. Okay, and then we have the inattentive. We have the combined type, which we also can classify as the overfocused ADD, ADHD. Now, if you have temporal lobe, limbic, ring of fire, or anxious, then on a psychological evaluation or a psych ad, it would show up as neurodevelopmental disorder. Okay, so that's important. But what it is, because of the neurobiology of the brain, is closely related to ADHD. Okay, so I hope that makes it a little clearer. Okay. So having one of the ADHD types make you more vulnerable to the corresponding addict type. Now that doesn't mean that 100% if you have ADHD, you're going to be an addict when you grow up or when you're a teenager. That's not what that means. But there is a predisposition for it, so it's good to be aware of it. Okay, so here again, I'm giving you how these are linked. So the compulsive addict does not correspond to an ADD type, but it is a person that usually has control issues, okay? The impulsive addict corresponds to the ADD, hyperactive, and inattentive. The compulsive impulsive addict corresponds to the ADHD combined type, or the overfocused ADD in the 7 ADD types, ADD, ADHD. We kind of use those interchangeably. Emotional addict corresponds to the limbic ADD, and limbic is the emotional brain, so that makes sense. The anxious addict corresponds to the anxious ADD. The temporal lobe addict corresponds to the temporal lobe ADD. Now, this is what I was telling you a little earlier, the ring of fire. So children with ring of fire ADD are in danger of developing 4 or more addict types because so many parts of the brain are affected. So when you look, if you could look inside the brain of a child or adolescent that has ring of fire, it literally looks like a ring of fire for the different parts of the brain that are overactive. So when it shows up on a SPECT, on a particular brain scan, it literally looks like a ring. So that's why it's called ring of fire. So the brain areas that are affected with ring of fire are the prefrontal cortex, the anterior cingulate gyrus, the basal ganglia, and the temporal lobe. And I will discuss that further in the 7 different types of ADD, ADHD. So some will develop all 6 addict types, especially if they experience trauma in their lives. So I used to work at an addiction center, and I have had clients that have 7 of the ADHD types and all 6 of the addiction types plus mental health issues, and we were still able to get them through it. So if you are interested in addictions, I would strongly suggest that you would take my course on this topic. So prevention and predisposition to addiction and not turning on what we call the addiction gene, which is very interesting. And this is some work that's been done by Dr. Bruce Perry and Dr. Gabor Mate. So children who have fully developed all the 6 core strengths, and again, 6 core strengths, another YouTube video, won't become addicts. So yeah, just do the search for the 6 core strengths. Very interesting information and how you can prevent some of these other genes. And not only the addiction gene, but genes like diabetes. There's a whole bunch that don't get turned on, which is pretty cool. So you might decide to go and try drugs, but they will be able to walk away when they choose to. So if they don't have the addiction gene. And it was interesting because in the addiction center, we used to see that when people would come in, I would do an assessment, and if they didn't have any of the addict types, they were classified as social addicts. And that was again because they had the 6 core strengths very solidly in there, so their addiction gene never got turned on. We can't stop youth and or adults trying drugs, but we can prevent the predisposition of them becoming an addict. Okay, so very important. So just to show you some of the particular brain regions. So we talked about the basal ganglia. So that's an area that is affected in the ring of fire. The frontal lobe, or sometimes what we call the prefrontal cortex. So that's the thinking brain. So all around here, that's all whoops, right to there, right to the parietal lobe. All this is thinking brain cortex, cerebral cortex, and characteristically low in a lot of the addiction types and characteristically low in ADHD. So that's one of the problems. The anterior cingulate gyrus, the ACG, also one of the things that's on fire in the ring of fire, and very prone to having addictions, right? So you see where this is sitting, it's in between the thinking brain and what we call the limbic system that's in the middle here. So the deep limbic system, see this? So prefrontal cortex, the temporal lobe, so your temples right here, and then the bottom of the brainstem made up of the midbrain, the pons, and medulla. The cerebellum, mostly for coordination, movement, but also thought coordination. Also somewhat involved in the different addiction types, and I'll show you that. 50% of neural connections are located in the cerebellum. It's a very important part of the brain that we often ignore. Okay, so the impulsive type. So what are some of the symptoms? What do we see in a compulsive type? They're over-focused, they're worrying, they have trouble letting go of hurts. So what's going on in the brain? They have an increase in the anterior circular gyrus. Remember, that's the part that's in between the thinking brain and that emotional brain. And so they're also low in serotonin. So regardless of what these people, the compulsive addicts, are addicted to, the thinking pattern, the basic mechanisms are the same. So they tend to get stuck or locked into the course of action. They have trouble seeing options. So they have what we would call cognitive inflexibility. That's because their ECG is stuck, and that's that gear shifter. Okay, so if you're stuck in your emotional brain and you can't seem to get out, you're not even having access to being able to think properly. So what happens with them is high protein diets and stimulants like Ritalin usually make this type worse. So interventions that boost serotonin in the brain are generally a lot more helpful. So supplements like 5-HTP, because 5-HTP is a precursor to serotonin. In other words, you put 5-HTP in the brain and boom, the brain will make serotonin. So for medications, they do best with the antidepressants, or what we would call an SSRI. Okay. So in these, so what would be some of the behavioral interventions that we could do that would boost serotonin? So we don't only have the medication that we can work with, we can also do behavioral interventions. So exercise. Because so remember I said 5-HTP, so that leads to serotonin, the natural source is L-tryptophan. So L-tryptophan helps, and like turkey, there's different things, you can just Google what foods have that, but exercise pushes that into serotonin. So what we need to teach and how we need to teach them, if you get an addiction-oriented thought in their head more than 3 times, then they have to get up and go do something and distract themselves, because all of a sudden they're stuck. They know they're stuck. So what they can also do is make a list of 10 things they can do instead of the addictive behavior. So you do that before they get stuck, right? So people with this type always do better with choices rather than edicts. So it's like, you have to do this. Yeah, that doesn't work so much. So you avoid the automatically opposing others and saying no. So the wording is really important because they have issues with control because of their overactive ACG, or anterior circular gyrus. The second type is called the impulsive addict, and so their symptoms are impulsivity, they tend to get bored, and they're easily distracted. So what is going on there is they have a low prefrontal cortex. So remember, I showed you just behind the forehead, that's your prefrontal cortex. There's different parts of it, but it tends to be low in the impulsive addict and in much of the ADHD types. So they have low dopamine, so that's another neurotransmitter or brain chemical. So this type, low prefrontal cortex, and the prefrontal cortex is the superior part of the brain, so it's involved in judgment, impulse, control, planning, and follow through. So when it's underactive, people can be easily distracted, bored, inattentive, and impulsive. So this type can be seen in the corresponding ADD type, ADHD type, and it's more common in males than in females. So again, we have behavioral interventions that we can do in order to boost the dopamine. Exercise, there you see it again, because we need blood flow. We need that reaching all the way up here. So if you think of the blood flow, and if you're living sedentary, you're not reaching all the way up to the top of the brain. So clear focus. So they write their goals down on one page and they look at it daily. So it's very concentrated so it doesn't get muddled for them. Outside supervision, they need someone to help them to go, hey, did you do this? Did you get that done? And not being insulting to an adult or an adolescent. They're not a child, but they do need the help. So they avoid impulsively saying yes to offers like such things as alcohol, drugs, food, or whatever their particular addiction is. So they need practice in saying no. So sometimes with my clients, I say, okay, I'm going to ask you a really silly question. So can I have all the money in your bank account? And it sounds goofy that you throw these questions at them, but they're like, oh, I have to practice saying no, and it actually helps them. So that's just one idea for you. The third type is the impulsive compulsive type. So it's a combination of the type 1 and type 2. So they're over focused, worrying, trouble letting go of hurts, impulsivity, bored, easily distracted. So what's going on? So they have an increase in the anterior circular gyrus, again, in between the thinking brain and the emotional brain, and they have low serotonin and dopamine. Okay, so if we go on, what ends up happening is some of these people end up with bulimia because there's a control issue. They have a low prefrontal cortex and a high anterior circular gyrus. So it's common in children and grandchildren of alcoholics. So that's very interesting too. So when you're doing the history, if you're a clinician or a teacher, just take note of that. Using treatments that boost serotonin or dopamine alone usually makes the problem worse. So increasing only serotonin only calms the compulsions but makes the impulsivity worse. Raising dopamine improves impulse control but increases the compulsive behaviors. So this addict types needs to raise both. For example, green tea, excellent for dopamine. 5-HTP, excellent for serotonin. Ritalin for dopamine, Prozac. If anybody is on medication, you need to be really careful, or an SSRI that increases serotonin. You need to be very, very careful in giving them any 5-HTP because you can have serotonin syndrome. So too much serotonin in your brain is actually dangerous. So please go to a pharmacist if you're adding any supplements. Okay, that's why I'm not giving you any dosages in this. So the impulsive compulsive addict behavioral interventions to help. Again, here we go. Exercise, set goals. You avoid automatically opposing them. Even to themselves, they know that they need to be aware that no will be a trigger. Avoid impulsively saying yes. Okay. Have options. They need to be able to even understand that there are options. So they can distract themselves going because they get stuck in their head. Okay. The next one is the emotional addict. So the symptoms are sad or depressed or low mood. So winter blues, carbohydrate cravings, loss of interest of things that usually should be fun. Sleep a lot, low energy, self-medicates to improve their mood. So they're trying to get their brain started. Okay, so what ends up happening is they have a low limbic. Okay, so limbic is your emotional brain. They have a low prefrontal cortex. There's not a lot of thinking going on. In addition to possibly a low cerebellum. So if you remember our diagram of the brain, the cerebellum is a part of the brain back here. Remember I said there's 50% of your neurons are back there. And the parietal, so that's right here. So there's your temporal, your parietal is back there. So they can also be low in vitamin D and DHEA. Okay. So the emotional, these addicts often use alcohol, marijuana, painkillers, or food to medicate underlying feelings of depression, boredom, or loneliness. This type is more common in women. Do you remember the other type is more common in men? So this type often has SAD. So SAD is seasonal affective disorder. They have low levels, like I just mentioned, vitamin D associated with depression, memory problems, obesity, heart disease, immune suppression. Vitamin D deficiencies are becoming more common in our society for two reasons. One, and I know, don't burn, I get it, but wearing more sunscreen and spending more time indoors. So we need to find safe ways of spending time outside because it's really good for the emotional brain. What are the behavioral? Full spectrum light therapy. And these light bulbs now, I mean, used to be when we were first working with clients, we'd have these big, long fluorescent light things and you'd have to carry them from room to room. And now you can just get it in a regular light bulb. So technology, yay. So hormones, clients need to be tested by a doctor. I have different handouts for you if you have that particular issue. Exercise, here we go again. This is a particular therapy. Again, if you write to me, I'll give you that one. So automatic negative thoughts. And if you look at the acronym ANT, okay, because those steal your happiness, and those come from cognitive psychology and positive psychology. One of the things you can do is write down 5 things that you're grateful for every day. Volunteer to help others, which helps you get you outside of yourself. You surround yourself with great smells, such as lavender, because that's a calming. Vanilla is another one. Meditation, try to sleep. Work to improve your relationships, because these particular addicts, often because they are very emotional, they can have turbulent relationships. Okay? The anxious addict, so anxiety, tense, nervous, predicts the worst, self-medicates to calm. So what's going on in the brain? The basal ganglia is too high, and that's located in the limbic system, or what we call the emotional brain. Their GABA is too low, so that's a neurotransmitter, and the neurotransmitter GABA calms the brain. So there's not enough of the calming neurotransmitter, so that makes sense. So this type often uses alcohol, marijuana, painkillers, sleeping pills, food or food to medicate the feelings of anxiety, tension, nervousness. So they're trying to fix themselves. So the physical symptoms often are muscle tension, headaches, stomach aches, nail biting, heart palpitations, shortness of breath. And some of these can, of course, these can be just directly related just to the anxiety, but it's all associated together. This type tends to predict the worst and may be excessively shy or easily startled. Interventions to boost GABA are generally the most helpful, so that's the one that we're going to concentrate on. Usually includes taking B6, magnesium, and GABA. So relaxation therapies can also be helpful with this area of the brain. Behavioral, oh, look at that, exercise. So kill the anxious ants. Again, that's a handout that I offer subscribers. For sleep, we use GABA. There's a whole bunch of things we can use. Valerian, magnesium, B6. Try to relax, such as meditation, prayer, deep breathing. I'm sure a lot of people know what that is. And this is very interesting, actually, hand warming techniques. So crazy as it is, if your basal ganglia is running too high, then your hands tend to be cold, and that's obviously not if you're outside, right? We're not talking about just environmental situation. So as you warm your hands, it actually helps your basal ganglia to calm down. So a little trick of the trade. The 6th one is the temporal lobe addict. So symptoms are temper problems, mood instability, memory problems, learning disabilities. High, here we go again, basal ganglia and low GABA. Okay. So this type tends to problems with temper, mood swings, learning problems, memory issues, abnormal activity in the temporal lobe. So the temporal lobe links with the memory issues, okay? Is associated with head injuries, and oftentimes inadvertent head injuries that people aren't even aware about. And as we start talking, all of a sudden different things come out and we're like, here's what went on. Lack of oxygen, that can happen at birth. Exposure to environmental toxins, and it can be inherited too. So treatments include higher protein diet and completely eliminating sugar. Sorry guys, if you have a sweet tooth, not so good for temporal lobe addicts. So the behavioral intervention that normalize the activities. So new learning. So new learning creates little baby neurocells called neurogenesis. And the way that we do that actually is by having a number of footsteps, so number of steps per day. 5,000 is the minimum, preferably 10,000. Obviously preventing further head injury. So if they're involved in like football, not such a good idea. Yeah, sorry guys, I'm messing with people. Things that help keep people chained to their addiction: avoid isolation, unforgiveness, blaming others, lack of social connections, cognitive distortions, that's very psychological, self-pity, that is just as addictive as cocaine, not healing from past traumas, high anxiety. Okay, so if you have any of those, really good to talk to a mental health professional. I'm available for consultations too. More information, subscribe to my channel for alerts and more awesome videos. You can write to me, you can take a look at my website, and like I said, for people who subscribe, you'll have access to my slides and different handouts. So thank you so much for joining me today. Please write different comments. I'd love to know what you think. Thank you for joining me. Take care. Bye.